Good afternoon. My name is Ronnie, and I'll be your conference operator today. At this time, I would like to welcome everyone to the Community Health Workers Development of State Network Learning and Best Practices in Organizing conference call. All lines have been placed on mute to prevent any background noise. If you should need assistance during the call, please press star, then 0, and an operator will come back online to assist you. Thank you. I would now like to turn the call over to Julie Aberdeen. Please go ahead, ma'am.
Hello, everyone. My name is Julie, and I will be providing you with a few pointers to familiarize you with the webinar technology. Please make sure to connect to our meeting room using the link provided in the meeting invitation. What will be presented today will be in the main presentation in the center of your screen. If you call your attention to the left-hand panel, this is where participants may ask questions, and you can type your questions into the chat box provided, and I will show you that right now really quickly with this arrow right here. Thank you for attending and enjoy the webinar. Lisa Renee, I will turn it over to you now so we can get started.
Sure. Thank you, Julie. Good afternoon, everybody. I'm Lisa Renee Holderby-Fox, and I will be moderating the call this afternoon. And what I'd like to start off with is just a quick overview of today's agenda and what we really hope to cover in the next 90 minutes. So we'll hear from our wonderful partner, Sanofi, about why they're engaged in this process. We'll do a quick overview of the call and a historical overview so that folks really understand where we've been and hopefully where we hope to go in the near future. And then we'll have a wonderful panel. We have folks from New Mexico, we have folks from Illinois, as well as Chicago. So, I'm sorry, Chicago is in Illinois. So we have New Mexico, we have Illinois, and we have Arizona joining us. And so with that, I think I'm going to turn it over to our partner at Sanofi, Anita, and I will be back shortly to begin the panel discussion.
So good afternoon, and thank you so much for joining us. Thank you for advancing this slide. I just wanted to let you know, some of you might not have ever heard about the company named Sanofi, and we are a global healthcare leader focused on patient needs. We're involved in research, development, manufacturing, and marketing of therapeutic solutions. And our strengths are listed in those growth platform areas. We have a lot of presence in diabetes and human vaccines historically. We also have innovative drugs, rare diseases, consumer healthcare, animal health, and emerging markets. So we're a very diversified organization, but focused on patient needs. If you could advance to the next slide, please. So you might wonder why a company like that, which is a diversified healthcare company, would be interested in working with community health workers and advancing this workforce. And one of the reasons is there's a perfect match if you look at our mission with a lot of the work that community health workers do. So our mission, the first piece is preventing disease and supporting patients. Well, that's really what you all do as community health workers, and engaging the CHW workforce through supporting policy changes, helping with secure funding mechanisms, and also workplace development or workforce development should lead to improved disease prevention and greater patient support through the work of the community health worker. And it also ties in with our mission of improving access to health care, because we've learned that the community health worker is involved with the whole patient approach and typically will link the right patient with the right intervention at the right time. And then finally, our third mission, our global mission, is exploring boundaries of medical innovation, but that also includes prevention and new care models for chronic disease and prevention. So the community health worker and all that the community health worker does really ties in very closely with our mission at Sanofi. Next slide, please. Next slide, please. So I just wanted to share with you briefly the work that we've done to date and share with you where we hope to go and partner with many of the leaders of the community health worker networks. So we're an international organization, but we truly appreciate the value of community health workers, and we're advocating for your advancement of the CHW workforce and the profession by providing support and resources. We're interested in developing solutions that could really leverage the asset of the community health worker to improve health care, especially in prevention, intervention, and community impact. To that end, in November of 2014, we convened an advisory board with many of the folks on this line. In fact, Lisa Renee was in attendance at our advisory board, and we received a lot of great advice about the history of the community health worker workforce, the potential, and where they would like to go. So we are interested. One of the big platforms that came out of that advisory board was really the interest and need in the development of a community health worker national organization. So we're very interested in helping pave the way, and this webinar is one of the first steps to catalyze that movement. We're also partnering with the National Health Plan to conduct some research regarding the role of the community health worker in medication adherence, and we're doing that to build the value proposition for the community health worker workforce to validate reimbursement to many different stakeholders. We also, in the Unity Conference in July, we're a sponsor there, and we've also compiled an electronic portfolio of evidence that really supports the strength that this workforce brings to improving outcomes. So next slide, please. So we just want to thank you for joining us on this journey to strengthen CHW networks and to improve health. And before we move on, I just want to thank three of the leaders who are on the line, as well as Lisa Renee, because Sergio Matos, Gail Hirsch, who was actually in the room with us, as well as Carl Rush, were all integral in building the way, the purpose, and the manner in which we're moving forward with you. And Lisa Renee was also very integral in how we're doing this work, this webinar, so that we're hearing from community health workers and sharing expertise. So before I move on, some on the line might not know about Lisa Renee Holderby-Fox. She is currently the Director of Workforce Innovation at the Central Massachusetts Area Health Education Center, the AHEC, here in Worcester, Mass. And in her role, she focuses on workforce development for community health workers, including providing education and training, leadership development, mentoring, and policy development. And before Lisa joined this role, she was the founding executive director of the Massachusetts Association of Community Health Workers, MASHWA. She's credited with growing MASHWA from a volunteer to a staffed organization, drafting and successfully advocating for 2 community health worker bills, which later were signed into law, establishing an annual Community Health Worker Day at the State House, and securing gubernatorial proclamations to recognize the unique contributions of community health workers to promote health equity and improve health status of the residents of Massachusetts. So with that, I'd like to turn it over to Lisa Renee Holderby-Fox. Thanks, Lisa.
Oh, thank you, Anita. So next slide, please. Thank you. So what I'd like to do is really just talk for a few minutes about the goal and the purpose of these webinars. And the goal of the series is really to develop, organize, and strengthen state networks to advance the CHW workforce. We all realize how crucial and important our state networks and associations are. And then the purpose of the series is really to pave the way for the development of a national organization for our profession, for the community health worker profession, through the creation of a platform of support and education. So we're really hoping that not only does this webinar series assist to strengthen state networks, but also really provides us a platform to solidify our national efforts and have a strong, standalone CHW national organization. Next slide, please. In order to do that, as we were talking and preparing for this webinar, we really felt collectively that it was important that folks understood that this is not the first time that we've come together with the hopes of having a national organization. So what I thought I would do is just really outline some of our successes in the past as well as some of our challenges. And the hope is that by doing this, we can understand the past, chart our future, and understand the lessons that we've learned in this process. So some of our successes were early discussions at the Unity Conference. And I'm hoping that everyone on the line knows about the Unity Conference, but that was really one place for CHWs nationally to come together, an affordable conference for us to come together. And so we took that opportunity to begin discussions about a national organization. In 2006, Georgetown University received some RWJ funding, Robert Wood Johnson funding, to really support the effort, to staff and support the effort of a national organization. In 2006, in the fall, there was a large convening of CHW leaders and CHW supporters from across the country. At that time, we had representation from all of the known CHW networks and associations to make sure that we were moving forward in a cohesive manner and that it was quite honestly something that we all wanted as a workforce. As we moved forward, we said, yes, we definitely want this and we want to keep moving. And we created a steering committee as well as several subcommittees. We selected a name, the American Association of Community Health Workers. So if folks have ever heard that name, now you know where that name came from. We also created a vision statement and a widely distributed code of ethics and core values for community health workers. So those were some of our wonderful successes. But as you all know, as you have successes, we also have challenges. Some of the challenges that we faced in 2006 as we were pulling this together were things like there were too few strong CHW networks and associations to take on organizing both locally and nationally. Resources. Although Robert Wood Johnson did offer some funding for this project, this association formation, many of the resources went to support Georgetown and the staff there, which was crucial. But we also understand now that we need additional support to support on-the-ground CHWs that are moving forward with this association. As you all know, time is crucial. We all don't have enough time, and we definitely found that out as we were organizing nationally to create an association. Not only is time very precious, but it was hard to juggle, quite honestly, the expectations and time limitations that some of our employers had while we continued to organize. Another challenge that we had that we hope, in fact, I know will change this time around because so many of you are on the call. But at that time, we had too few CHW leaders that were spread way too thin. And then, as I mentioned earlier, limited employer support for the effort. So as we go forward, please note that lots of work has happened. I'm hoping that we build upon what was done. And I definitely, in this process, would like to give credit to folks who were doing this work long before I came along and having discussions about a national network long before I came along. As well as I want to thank those of you who may be on the phone that participated in those early efforts. I know that it was a struggle, but please note that those efforts were not in vain and that those efforts have given us a place to begin. Next slide, please. So I know that was very quick overview of where we've been, but I'd really like to spend the meat of our call today talking with our panel members. And in order to do that, I'd like to introduce all of them. So first we have from Chicago, Letitia Boughton-Price. And Letitia has been dedicated to enhancing and improving the lives of youth and families for over 20 years. She's currently the Chicago Community Health Worker Local Network Coordinator under the fiscal leadership of Connect One. Letitia is responsible for sustaining and building a network of over 400 community health workers and other stakeholders, providing guidance, training, advocacy, and fundraising initiatives for the network. Thank you for joining us, Letitia. From New Mexico, we have BJ Shisketsky, and BJ, please forgive the pronunciation of your name. I've had difficulties with that for years. But BJ is the founder and CEO of the New Mexico Community Health Worker Association, which was established in 1995. She's led the organization into forming a 501c3 nonprofit and created sustainable funding source for training community health workers through its resale boutique operation. She's established community health worker programs at 2 New Mexico hospitals and has been a community health worker and has also managed community health worker programs. She's active in policy development regarding the community health worker model and has been successful in passing legislation to certify CHWs. Also from New Mexico, we have Denise Ceballos. Denise has been a promotora de salud community health worker in New Mexico for more than 15 years. As a Hispanic American and native speaker of Spanish, she has worked with hundreds of underserved, rural, and impoverished families in New Mexico's Hispanic communities. She's been a leading advocate at the state level to recognize and improve working conditions of New Mexico's community health workers. She's also the current president of the New Mexico Community Health Worker Association and a member of the Department of Health New Mexico Community Health Worker Advisory Council. And she's been recently selected to be on the New Mexico Department of Health Community Health Worker Certification Board. And then to round out our discussion today, we have Florabella Rolando. She has more than 18 years experience, and she's led the community health worker professional development and farm worker advocacy efforts in Arizona. Florida is a founding member and president of Arizona's Professional Association of, by, and for Community Health Workers, the Arizona Community Health Outreach Workers Association, or as we affectionately call it, ASCHOW. She's leading the Arizona Community Health Worker Network and was launched by the Southeast Area Health Education Center, or CHEC, and partners in 2014. Flor is the Community Health Worker Certificate Program Instructor for Arizona Western College in Yuma, Arizona. And I would like to thank you all for joining the call today and sharing your expertise. And so just before we go into the panel presentation, I'd like to share with you how this is all going to work. Each of the panelists will answer the same question. We will alternate in the order that they're answered. Each question, after the panelists have an opportunity to respond, will open up a question and answer period. Please note that we understand we will not be able to answer all questions coming through at this time, but be rest assured that all questions will be answered. We will respond electronically and send out responses to all those who've registered for the call today. Thank you very much. Next slide, please. Our first question to the panelist is, what was the most appealing or valuable to community health workers in your state about having an association or an organization? And I think I'd like to start with New Mexico, and maybe BJ and Venice, could you please start and respond to the question?
Yes. This is BJ Shashelski speaking, and we started the association just to ensure sustainability of the community health worker model, and we wanted to make sure that the community health worker voice was heard. We felt that it was important to provide leadership development among its members and community health workers throughout the state, to hold annual training conferences because training needs were very much identified when we tried to set up the organization. Opportunities to network with community health workers statewide. They were able to communicate and learn from one another and trade information on resources. We held quarterly trainings, and these are offered on an annual basis every quarter, and we changed the venue to different geographic locations so that we can visit other programs throughout the state. We also felt that it was a great source of information regarding the community health workers around policy development, any training that was made available to them throughout the state, any job openings that may be available for community health workers, and also the discussion of certification and moving in that direction. Also, community resources. It was important for them to apprise themselves and each other regarding any community health resources that were available that they could help their clients with. And at our trainings, we offer information on many other topics.
Thank you so much, BJ. Leticia, could I please ask you to respond as well to the same question?
Yes, thank you. For the CHW local network, it was more about an opportunity for community health workers to offer that peer-to-peer support, and then an opportunity for providing resources and trainings, and to just talk about sustaining the workforce, like what would it take to get the recognition for community health workers here in the state of Illinois. So the network was just that opportunity for CHWs to get together, again, to provide peer-to-peer support for one another, share resources, find trainings to help them in the work that they were doing, and then a place to find their voice and figure out how to get recognition in the state of Illinois.
Thank you so much, Leticia. I'm sorry. Flor, can I ask the same question of you? What was most valuable?
Yes, definitely. Thank you. One of the things that I remember in 2001 when we came together as a group, we didn't call it ASHA yet. We came together because there was a need for getting to know other CHWs that were working around the same issues around the state, that when we knew that they existed but we didn't know them or knew what kind of conditions or what kind of settings they were working at. So the need for training around the state on chronic diseases. In 2001, diabetes was one of the things that was really something that we talked about, and when a lot of programs were really successful in getting groups together, so the need to share lessons learned, what worked, what didn't work, really was the thing that brought us together as a group to start talking about how can we work together, how can we start communicating among ourselves to start sharing, to start learning from each other, because we knew that because of the efforts that we were doing in our communities, we were able to be successful in helping our community members and to manage their diseases. So that was one of the things really that was really appealing to us. The other one was that we knew that we existed, and we knew that organizations knew we existed, but we were not taken into consideration when decisions were made for community health workers. We called them promotores back then. And one of the things that we wanted to do is to build that recognition about our CHWs in Arizona, to build that consensus that we was the workforce, but we were not recognized as one. And the other one, like I said, the relevant issues that we were working on, and also one of the things that we realized is that we were really focused on trying to develop programs to sustain communities healthier, but at the same time, we knew that we needed other kind of trainings. We needed trainings on leadership and advocacy. We were working with a lot of programs with little resources, so sharing information, sharing practices was really a way to continue with our efforts in our communities. So that was one of the things that really was appealing, coming together and realize that we were doing amazing things, but were not taken really into consideration, or we were not able to raise our voices because of that. So wanted to come together and start telling everybody, let's form, let's talk, let's unite, and start putting our voices out there so our workforce can be strong in our communities and in our state as well. So that's one of the things that really was really appealing for us.
Thank you, Flor. I would like to remind folks that you do have the opportunity to ask questions of our panelists throughout the presentation. And after each question, there will be an opportunity for us to answer at least one question before we move on to the next area. And as I said before, any questions that are not answered, we will make sure that we answer them and send them back out electronically. Next slide, please. Thank you. Our second question to the panelists: what key stakeholders and other external resources were critical to the development of your CHW network? And this time I'd like to start with Chicago. How about Leticia?
Great. For us, it was very instrumental to have organizations on our side that understood the community health worker model, that believed and valued community health workers. So Health Connect One was very near and dear to us in the beginning, because they found money to support us, and they are still our fiscal agent right now. So just to answer that, the critical point to our existence is being able to partner with people that know and understand the CHW model and know the value and the worth of community health workers.
Thank you very much, Letitia. Flora, may I ask you the same question?
Yes, the stakeholders that were really critical to our development, I believe it was the Rural Health Office from the University of Arizona back then that was the staff that brought us together in informing a group, informing a meeting, informing a training. They brought us together in a form of providing us a leadership training, but at the same time, it was a way of gathering CHWs from around the state that we knew that we were working in communities, but we didn't have a lot of the support from supervisors or from managers. And so the Rural Health Office staff back then were really critical in getting those permissions for us to attend a meeting in Tucson, because we were far away, so they would cover our transportation and everything. So I believe that because of their interest, and everybody knows that the University of Arizona, they're being critical in writing all those documents and papers and documenting the model and how it's been successful. And because of their interest, because of their leadership in developing a lot of the programs here in Arizona, and continuing providing that support and that training to CHWs throughout the state, I think they continue to be critical in the development of the CHW network here. And also, not to mention the Arizona AHEC departments as well. Back then, Don Prue was part of that, and he was really critical and instrumental in making sure that there was a lot of information, a lot of training for CHWs, a lot of gatherings, and also a lot of support for the programs, especially the programs that were out in the rural areas and were not really connected to big programs or big organizations. He was really all the time trying to get those CHWs promotoras involved into the trainings, involved into the gatherings that were available, and making sure that, again, the supervisors were supportive of that efforts, and we're also trying to get the other organizations. Back then, when we started organizing, clinics were not supportive of having CHWs or promotoras here in Arizona, so trying to get those organizations that were really striving to have programs with promotoras CHWs, but did not have the resources, but they did have the commitment of supporting CHWs and promotoras to attend. So I think it was a combination of not only the professionals that were working at the university level, at the AHEC departments, but also the supervisors and managers that knew about the promotora CHW model and were instrumental in making sure that their CHWs participated in and also informing the group here in Arizona.
Thank you so much, Flor. And also from New Mexico, Venice or BJ?
Hi, this is BJ Shashelsky, and I'm going to go ahead and talk a little bit about this question. When we first decided to establish a network here in New Mexico, the community health worker model was not well known, and there were a few community health worker programs, but we really felt that there was a great need for an education process, and so we brought different stakeholders to the table. We looked for statewide programs that were employing community health workers. We also brought in the New Mexico Department of Health, the Department of Labor, other CHW program funding sources, community health councils, universities, colleges, and federally qualified health centers who employed community health workers. We brought in the managed care organizations and then legislators and champions. And so our main goal was an education process regarding this model. We are classified sort of as a frontier state, And so programs are in many rural areas and in the Native American pueblos, and the opportunities to communicate with each other are very limited and very difficult. And so we felt that it was important to bring all of these different entities to the table. Funding was always an issue for many of the community health workers. A lot of programs would start up with soft money from grants, and they would be very effective. The impact was very important. However, when the grant ended, the community health worker program would also end. And so we felt that there was a need to bring in, like, the managed care organizations to see if we could find some way to provide sustainable funding for these programs. The education piece, many of the community health worker programs did not have a source of training, and there was no training available for a community health worker program. And so bringing different stakeholders to the table to help develop training for community health workers was important. The Area Health Education Center was one of the entities that we brought on board, and our first training that we developed was a reaching out curriculum that had a maternal child health emphasis to train community health workers that were working in those areas. So we just worked diligently statewide to bring as many stakeholders on board as we possibly could to educate them on the process. Legislators were an important component, because if they were made aware of the work that community health workers were doing throughout the state, then perhaps we could get some funding or some policy development. We worked on having a community health worker day during the legislators' sessions. We brought in, we had, I can't recall right now, it's blank, but we brought in programs to provide education to them, where all the different programs throughout the state during the legislative session could set up tables to inform. We had press conferences and brought the media in. So those are some of the things that we felt were critical when we were establishing the network.
Thank you so much, BJ. Venice, would you like to add anything to that slide?
No, thank you, not at this time.
Great, thank you so much. We do have a question that I would really like to pose to all 3 states. And how did you find programs employing CHWs? As we all know, in many states, CHWs have many different job titles. And so could you share how you found those programs?
In the state of New Mexico, we have county health councils that were in 28 out of 32 counties. And so the entity that I was employed under, that we received the funds under through Robert Wood Johnson Foundation, they would hold annual meetings and quarterly meetings with the councils. And so the councils would put together a database of programs in each of the counties that were located throughout the state. And that was how we were able to find out what programs were located and where. And then one of the things that the maternal child health councils identified was a need for training these community health workers and a need for looking for funding sources to sustain these programs. And so that was, the maternal child health councils were a very large, very instrumental in helping to establish the network itself.
Thank you, BJ. Letitia, do you have anything to add to that? How did you begin finding CHWs in your state or in Chicago?
Well, because Health Connect One has been in existence for over 20 years, they kind of had a pulse on where to, places to identify community health workers. The other resource that we were using was our current community health workers who knew where other community health workers were working, and different grant opportunities. As BJ mentioned, we also utilized that resource as well. And I can't forget conferences was another way to help identify other community health workers.
Thank you so much. And we do have a question about staff, and because we have at least two of the associations networks on the phone do have staff members, could New Mexico and Chicago please speak to how you found a staff person to facilitate the initial process, if you had a staff person from the beginning?
This is Lakeisha from Chicago, and Wandy Hernandez, who was the former chair of the American Public Health Association CHW section, was our first staff person. And just by engaging with other organizations, like we have a medical center called Alivio here, and through her previous employment, we found other community health workers that were engaged in the process that, you know, took a strong leadership position, and that's how we ended up getting Laura Behenya to be the other staff person. And just through her relationships and getting out there in the community, we ended up hiring Alfredo Lopez as the other staff person. So pretty much through word of mouth and identifying strong leadership through our meetings and trainings and so forth, that's how we were able to identify staff.
Thank you so much. Could we also ask New Mexico, Venice and BJ?
Okay.
Sure.
This is BJ. Initially, when the funding was procured from Robert Wood Johnson Foundation to formalize the network, the entity that applied for the funding was the Prenatal Care Network under New Mexico, University of New Mexico Health Sciences Center. And so they wrote a grant to RWJ and received the grant to formalize the network. And I applied for the position and was hired. And so this was a 3-year grant, and I was employed as the coordinator of the network for 3 years. So during that point, it was my job, of course, to travel throughout the state, attend the community council meetings, and try to find out as many people that were working in the field as possible to engage them as members. Then post the grant, we kept the association going on a volunteer basis, so I continued working without being paid for, and continued having the quarterly trainings and the annual training conference till we became a 501c3. And we applied for it in 2002, and then we actually received it in 2003. So that was how it kept going, without a staff person, without any paid staff. And then in 2003, we received funding, and we were able to employ a staff person to coordinate, but the funding it wasn't long. It was through HRSA, and that funding ended in 2005. So then we set up the resale boutique and have kept it going with the resale boutique without staff. I'm currently paid for through a grant 1/3 time, but that's not always the case. There's not always a salary for the coordinator.
Thank you very much.
Mm-hmm.
I'm going to ask you all to think about another question that we had to be asked the panelists. And first of all, are there apprenticeship programs being utilized in your states, is the first part of the question. And the second part is, if in fact there are apprenticeship programs being utilized, are there any challenges with partnering with businesses to hire CHWs?
This is Letitia from Chicago, and this conversation has been bouncing around for a little while here in Illinois, and right now we're just still talking about it.
Thank you very much, Letitia. Does Arizona utilize an apprenticeship program for CHWs?
No.
And how about New Mexico? Thank you, Florida. And New Mexico? Are you utilizing an apprenticeship program for community health workers?
I had to unmute you. We, as far as I know, do not have apprenticeship programs in New Mexico.
Thank you, BJ. I think from the panel's response, it would appear as though the idea of CHW apprenticeship programs is fairly new, and there aren't many states yet who have developed apprenticeship programs for community health workers. Thank you all for your input on that question. I know I put everybody on the spot as I did that. Next slide, please. Question 3 to the panelists. Please describe the organizational structure of your community health worker network. An example could be, is it statewide? Does it have a governance structure, a 501c3, or does it have a fiscal agent? We just talked about staff. And let us know also how long it's been in existence and if you have membership dues. I know I just asked you to respond to a lot. And could we please start with Flor? Flor, is your line muted?
Nope, it's not muted. Hello?
Hello, would you respond to the question of describing the organizational structure of your CHW network, please?
Hello, can you hear me? Hello?
Hello? Yes,
Hello,
we can hear you, Flor.
Okay, thank you. Yes, ASHA has been in existence since 2001, and we are a board, our board of directors, and we have the president, we have the vice president, and we have a treasurer. We also have an advisory board, which is a newly board that was developed through a HRSA grant with the Southeast Arizona Area Health Education Center. They received a grant, and actually that was the first grant that is paying for a half-time person to organize the association here in Arizona, and that is paying half of my salary right now. And we are not a 501c3. Actually, CHEC is our fiscal agent since 2002. We have been in the process of incorporating, and for some reason, and lack of time, I remember the slide, lack of time, we are so spread so thin that we did not really complete the process. But right now, at this moment, we are working with the Arizona Department of Health Services and trying to move forward the incorporation of ASHA as a 501c3 here in Arizona. And we do have membership dues. The way that we set our membership, we decided that when we began, it was $15, the membership dues, and the CHWs could pay them in 3 payments, $5 every time that they could afford it. And if they could not afford it, they could also get a scholarship for the $15, and they would become a member as well. One of the things that we wanted to make sure is that we were reaching all the CHWs, promotoras, and CHRs in our communities and trying to organize and get them together. Our original board was composed of CHWs, CHRs, and promotoras. And since all the funding has been really lack of funding, I might say, here in our communities, a lot of the programs that existed back then are no longer in existence, and a lot of the programs that were really supporting the membership dues are not there anymore. So what we're trying to do right now, we hold a conference, and I'll be speaking a little bit more about that later on, and that is how the members pay their dues. They pay for the membership. At the same time, they pay for the registration for the conference. We also have a currently in Arizona a movement where we have the Arizona Community Health Workers ASHA as the main center of the movement, but we also have the university, the businesses, the organizations, the hospitals, clinics, health departments, forming a coalition to come together and really inform and educate all of the stakeholders from around the state on what is the CHW movement is happening, what's happening here in Arizona, and what are we trying to accomplish. One of the things that right now at this moment we're trying to work is not only to structure ASHA as a 501c, but also to strengthen the workforce in around the state and get recognized. The other thing that we have recently happened here in Arizona, the Arizona Department of Health Services, they hired a CHW manager, and she is working within the state trying to support the ASHA ASHA work and ASHA conference and ASHA structure, because she is part of the ASHA network, but at the same time, she doesn't hold the vote because of the conflict of interest with the state. But she is part of our membership and she is part of our board, but as an auxiliary board only. And like I said, the HRSA grant that CHEC received has allowed a network, a smaller group, to come together to work into forming and structuring recommendations of how we should, our legislation should look here in Arizona, how should credentialing look here in Arizona, and what are the things that we need to take into consideration. At this moment, we are forming and we are organizing, but at the same time, we're looking at other states. We're talking to CHWs around the state here in Arizona and trying to get their info and trying to have their input as how they see us moving forward. So the structure of Arizona is really has been there since 2001, but just since last year, it's really coming together. It's really getting stronger, and the structure, I think, is really forming in a way that we're going to be able to recognize it next year. But at this moment, we are still in the process of making sure that we take the steps forward, but in the steps that we take, that we make sure that we're taking the right steps in the right direction.
Thank you so much, Flor. Next slide, please. New Mexico. BJ and Venice,
Yes.
would you mind sharing?
Sure, this is Venice. Can you guys hear me all okay?
Yes, thank you.
Okay, so originally the network got established in 1995, how BJ had mentioned earlier, under the University of New Mexico Health Science Center through a Robert Wood Johnson grant. And that went on until 1998. Then followed by that, a post-grant, we became a 501c3 in 2002. So one of the requirements of the 501c3 was to establish a board of directors. So our board of directors is made up of solely CHWs. We have a chair, we have a vice chair, we have a secretary, a treasurer. And the way people get appointed for the board of directors is they send in an application with demonstrating interest that they want to be on the board. And then the board reviews it. But so far we've never denied anybody. Usually applications are not jumping at us all over. We usually sometimes struggle to get some of these positions filled. So the other thing is we have one paid staff member, which BJ referenced to earlier, and she is the director, CEO, and funded through grants. So one of the things I'd like to highlight is that it really takes a leader to move these networks forward. BJ definitely has done it when, there's been money and when there has not been money. And sometimes there's no money at all, and she keeps the network going. So that's what it takes to keep these going, because you're not always going to have grants supporting them. We also have the CHW network is statewide. It's all over New Mexico, and it also has an executive committee.
The executive committee consists of CHWs. We have a president, we have a vice president, we have a secretary, and those elections are held annually at one of our conferences. The membership dues are $30 per individual, and then we also have the corporate price, which is $125. Next slide, please. And BJ, did you want to add anything else to that slide?
I wanted to add, this is BJ, I wanted to add that in the corporate price, that is for a larger program that may employ more than one community health worker, and so the $125 will allow that organization to add 6 members, and then each additional member is $25. So if they have more than 6 people working under their organization and they want to enroll all of them as members, they just pay an additional $25 extra per member after that.
Thank you so much. Next slide, please. We're going to ask you the same question. Would you describe the organizational structure of your CHW network, please?
Yes, so Letitia from Chicago, and for us, we are right now under the fiscal leadership of Health Connect One. We got our first grant through Health Connect One in 2003, but the group was organizing prior to that under the leadership of Wandy Hernandez since 1997. And since 2003, we were able to get funding through different types of sources. We established a steering committee, and that's when I joined the network back in 2010. From there, we developed a board of directors, and now we are continuing to work on becoming our own entity, going for the 501c3 status. So we're in that process right now. So we are still under the fiscal management of Health Connect One, and we still have a board. We still have advisors to the board, and right now we don't have a membership, as far as dues are concerned, no dues affiliated. Like if you are a community health worker and interested in advocating and supporting the mission of the network, then right now you are considered a member. But in the future, I do look to incorporate some of the structures that have already been discussed as far as membership dues and things of that sort.
Thank you so much, Letitia. I'm just glancing to see if we've gotten any additional questions around the organizational structure. And I also wanted to ask you all, we did get a question that I'm just going to reframe just a little bit. I want to ask you all, do folks need to have the job title of CHW to be a part of your networks or organizations?
This is Letitia, and no, they do not. While we're still trying to establish some consistency by adopting the CHW Association's definition of a community health worker, we have included that in our legislation here in Illinois, and everywhere I'm going around speaking about community health workers, I try to get individuals to adopt that same definition. But I did receive some information from Carol West, who had developed a list of 150 titles for community health workers. So we do not, limit engagement to individuals based on the titles, but if they kind of fit up under that umbrella and they have one of those job titles, then we do allow them to participate.
Thank you so much, Letitia. Would either Arizona or New Mexico like to respond to that?
This is BJ in New Mexico. We don't have a policy regarding the title itself. Like Letitia, we have adopted the American Public Health Association title or job description. The CHW Advisory Council sent out a survey a few years ago, and we had 800 responses from different people doing community health work, and so we were able to identify more titles. But one of the things that we try to do is we try to educate people, for example, on the definition, and we've done workshops and visited different groups that meet throughout the state, and we actually take an umbrella and we give them the definition, and we say, if any of you fit under this definition with the work that you're doing, come and stand underneath our umbrella. And that way, there's very few people sitting left in the room because they completely understand that that's what they are and who they are once they understand the definition. So that's kind of a way of bringing people in, but we don't have a policy to exclude anyone, and so anyone doing community health work is allowed to become a member.
Thank you so much. Flor, would you like to respond to that as well? Flor, are you muted? Okay, I'm going to move us along then. And if we could have the next slide, please. I'd like to ask each of the panelists, what strategies did you use to engage members, and in particular to engage CHWs? Can I start with BJ and Venice, please? New Mexico.
Sure, this is Denise. So some of the strategies that were used to engage community health workers were doing some focus groups. A couple years back, we brought CHWs to the table and pretty much asked a bunch of different questions around the mission, how the network would benefit them, and we got a lot of information from those focus groups. The other piece I would say is probably word of mouth is the most effective way. CHWs spreading the word themselves. I feel that in our state, more and more employers are aware that the network exists. So BJ, she gets all the inquiries, but it's mainly word of mouth. We've also created flyers that go out to all of our partners. We have a quarterly newsletter that is sent out. In that newsletter, different training topics are listed, also success stories from different CHWs around the state. We also have social media that we use, such as Facebook is popular. We have a network webpage, and it's nmchwa.org. We also maintain a listserv of all CHWs. So anytime there's job positions, any trainings going on, we send it to that listserv. We also have the network executive committee members that attend different events. So anytime there's conferences or anything that's related to CHWs, we're there with our brochures, telling them about the association, the network, about the fees. The one thing that we often get is what happens if my employer cannot cost the fees. We also have some resources available for that. We also have network T-shirts with the logo that were given to at one of the conferences, and I've seen those shirts everywhere, and they've actually been really resourceful to get more membership. I'm not sure if it was the design of the T-shirt or the color of it, because I've seen men wear it, I've seen women wear it, but they seem to really embrace that T-shirt and wear it out in the community. We also offer travel stipends to our members for them to be able to attend some conferences and trainings. And the main funding for that comes out of the resale boutique. So we know some of our CHWs, their employers will not cover those costs, so the network definitely helps and supports in that way. BJ, did you want to add anything else to this slide?
Okay, thank you, Venice. I'm going, BJ?
Yeah, I was muted. No, I really don't have anything to add other than for each of our conferences or quarterly trainings, we're able to find sponsors such as the HMOs might sponsor lunch or breakfast for our trainings. So that helps us to be able to engage people and have funding to provide food and drinks during all of our trainings. Also for the conferences, we offer scholarships, and the scholarships are given through an application process where they will say what the need is and how many people that they will touch with the training that has been provided. And they have to understand, has to be signed by their supervisor, and understand that they have to attend the training both days. Otherwise, we will bill their organization if they don't show up, or because we are holding those spots and those scholarships. So we're pretty firm about, if you apply for a scholarship and you receive it, you do need to come to the conference and be there. So that's basically it.
Thank you very much,
I forgot
BJ.
to add one last thing about the huge piece of engaging CHWs is the quarterly trainings are rotated throughout the state. So we know that many CHWs cannot travel for many different reasons because it's too far, their organization doesn't cover the cost. So we make it a point of making it, at different parts of the state. That way we have representation from each of those areas. And that's all I wanted to add.
Thank you very much. I'd like to ask the same question of Arizona. Next slide, please.
Hello, this is Olivia Redondo. I'm sorry, I had been disconnected for some reason. I came back, but are we on the last question?
Yes, we are. And
Okay.
your slide just came up.
All right, thank you. The way we have used to engage CHWs has always been the conferences and the meetings, and we developed an annual training, and that annual training was the way that we engaged CHWs and promotoras and their supervisors to be able to come to the training. And actually, we have been doing a conference for some time now, and the way we provide this is that we announce our conference throughout the state, throughout all the organizations and health departments and hospitals that utilize the CHW model. We provide a lot of the outreach and word of mouth also to our communities, and engaging the CHW that we know that they don't have an organization behind them. We also try to include them so they can be part of the network as well. And one of the things that we always knew and we always continue to see is that CHWs are really trying to be part of a network. They're trying to be part of a body of work where they can come together, where they can feel safe talking about issues that are happening not only in their communities but also within their organizations. A lot of things that we've heard and we continue to see is that CHWs are really trying to get support from their supervisors and managers, and a lot of them do not find that support within their own organization. So coming together with ASHA and talking about the issues and talking about what other programs are doing and what other supervisors are providing their CHWs provides a path and provides a structure where we can continue talking and kind of develop what things we need to work here in Arizona to get CHW supervisors engaged into the CHW movement and the workforce. So networking, I think, is one of the things that really engage CHWs, networking to come together and talk about what they are trying to do within their organizations and things that they cannot get through because of the lack of support from their supervisors. So one of the things that we have been working and trying to do here, and this is because of the CHW's issues and concerns, is trying to engage CHWs to come together and get some information of what kind of training we need to develop for CHW supervisors. So we're at that point right now where we are not only engaging CHWs to be part of Agile, but we're also engaging CHWs to help us develop what kind of tools we have to have here in Arizona to have that consensus around the managers and supervisors that CHWs are valuable for their workforce and for their organizations. So I think that we will continue with those strategies, bringing the conferences. We also moved our conference from Arizona from one point to the other. We're trying to see where we can get the most CHWs to attend. We know that times are critical and the funding is not there anymore for a lot of them to come to our conference. So we have partnered with the ADHS department and they provide us some funding so we can provide some scholarships for CHW to attend our conference. So a lot of them, even if they don't have the support from supervisors and managers, if they get their days off, we will allow them to come. We provide them scholarships for the registration and also for hotel. So we're trying to engage them, and at this point, I think we will continue with the same strategies we have.
Thank you very much, Flor. Leticia, could I please ask you to respond to the same question? What strategies have you used to engage CHWs as members?
Well, here in Chicago, we have implemented some of the same strategies that New Mexico and Arizona has. And as far as the forums, the social medias, the trainings, newsletters, websites, brochures, meetings, conferences, and trainings. We have reached out directly to some employers. We have created these policy committees and curriculum and training committees to get community health workers more involved in those processes. We try to get them involved in any advocacy opportunities around community health workers. And all that is really handled through our constant contact, our listserv that we have. So, meetings and conferences and trainings are other ways, but especially word of mouth. So that's how we've been able to engage community health workers and stakeholders.
Thank you so much, Leticia. I would ask if the panelists would just expand a little bit upon their engagement of members and to really hone it in on policy issues. So I'd like to ask you directly if your network is involved in policy issues, and if so, how do you continuously engage CHWs in these efforts?
So this is Leticia, and it's a challenge because a lot of times a lot of the policy work that needs to happen is during the day, and that's a lot of times where they have to be out in the communities or doing the work that they do. So we have definitely tried to keep community health workers in the loop through our Facebook, through our social media avenues, and sending information through emails, through our constant contact, say that 10 times, constant contact listserv, but also just making sure that people get the information around policies and making sure that they just have that opportunity to get engaged in that process through those avenues.
Thank you, Leticia. Could I ask New Mexico directly, because I know that you've been very engaged in some policy efforts. Can you talk to us, A, about what some of those efforts have been, and B, how you've engaged CHWs as you move forward? Venice or BJ?
This is Denise, and then BJ, you can add some more. So I think we've engaged. It's been a topic all along, different policy issues that arise. We haven't really, highlighted this as a policy issue. It just becomes a norm of a conversation, because I believe we probably address a policy issue every single time we meet within our quarterly meetings that we have, our trainings. So, again, word of mouth, that's how we engage our participants. This policy and, advocacy is something that CHWs we love to do. So I think it naturally comes within our conversations that we're talking about. Sometimes we don't even realize that it's actually a policy issue, because CHWs, once you bring them together, they're definitely talking about the issues that are happening within their communities, things that are happening within their jobs, how they're, sometimes not valued for what they're doing, they're underpaid, and then we start to problem solve, and then we start to go into next steps. So I don't think at that level we're actually even labeling it, this is a policy issue, but we're just working through some of those processes, and that's been going on for years. But I could let you know that it happens pretty much at every gathering that we have. And BJ, do you want to add anything else?
Yes. You asked a question regarding policy development, and initially we brought our members together to ask about putting together legislation. And so the first piece of legislation that we helped to introduce was a Senate Joint Memorial, and that was to do a study statewide. And we made sure in that Senate Joint Memorial that we added stakeholders, and we wanted the Department of Health involved, and Department of Labor, many other different stakeholders throughout the state. And so it was through the work of one of our quarterly trainings and involving the community health workers in that conversation, as Denise said, to look at, what was going to be included in this Senate Joint Memorial. And so we've been doing that initially from the very beginning. But right now we have a more formal process that's through the CHW Advisory Council, and that council meets on a monthly basis. So anytime there are also policy issues that are being worked on through legislation, or more recently when the Office of Community Health Workers was established, and that was established through one of our Senate Joint Memorials that we called for an office to be established. So right now there's a more formal process through that, but we make sure that CHWs are engaged in that process. They're part of that CHW Advisory Council, and anytime there needs to be CHWs at the table to testify before different committees and that kind of thing, we always make sure that CHWs are brought to the table.
Thank you, BJ. We did get another question coming in, really asking about peer support specialists and patient navigators. And before I ask the panel if they have thoughts, I would like to share an experience that I actually had on Tuesday. I had the pleasure of speaking at a behavioral health conference. So many of the folks there were peer support specialists. And, what I really suggested to them was that they are an extension, an expanded CHW workforce, and that we embrace them. However, I felt as though, just like we ask for ourselves, I suggested self-determination for them, but told them that we would definitely embrace them as colleagues, as fellow CHWs in our state of Massachusetts. I should have said that. And the other piece is that for many years we've also included patient navigators as part of the CHW workforce in Massachusetts. I understand that it may look different in other states, but I just wanted to share that. And the peer specialists were ecstatic to be connected with community health workers. So I'm hoping that happens across the country as well. Can I open up that same question to any of the panelists who would like to respond? Do peer support specialists and patient navigators, are they included in your efforts?
This is Letitia, and I am the co-chair for the Illinois Community Health Worker Advisory Board that was established through legislation that was signed last July. And part of the responsibility of the board is to come up with recommendations around training and certification for community health workers. And yes, certified recovery specialists have come up, and patient navigators have come up in the conversation. CRSS as a way to have a pathway for community health workers, but patient navigators, interesting enough, they have come up in the conversation to get retrained as community health workers here in Illinois. And one of our colleges is even entertaining a degree, kind of like on the line of an associate's degree under public health as a patient navigator. And I'm heavily involved in that conversation because, again, just from conversation that I've had before, there is this sense that patient navigators are a role and responsibility of a community health worker, and because we already have a community health worker training program in existence at a couple of our community colleges here in Illinois, why would we want to create another degree titled patient navigator when, you know, that is part of a role and responsibility of community health workers. So we are in communication with that university who is looking to just get people at the table to talk about this, because they are looking for avenues for those patient navigators that have been working with the insurance marketplace and trying to find, career pathways for those individuals. So here in Illinois, we are talking with them, and they are definitely a part of our conversation.
Letitia, could I just ask a follow-up question? Could you share which college has established an associate degree program?
Well, I should say they're talking about it, and they're getting everybody to the table about it, but it is the University of Illinois School of Public Health here in Chicago.
Great. Thank you so much for the clarification there. Flor, would you like to respond to? Yep.
Yes, here in Arizona, peer support model, it's really a strong one. Actually, they are able to be reimbursed for their service under Medicaid, and we are also learning from what I know it's behavioral health. Behavioral health, for some reason, it's become more easier to be reimbursed for the services than the CHW model. So we're trying to see what they're doing and learning from them. At the same time, we are integrating them as well as part of our CHW model. We've always asked everybody that's working in communities to be part of ASHA, but for some reason they separate themselves and they become another model. And I think we're all doing the same work. We're all doing the same scope of practice. So I think we should be part of the same group. And on the patient navigators are actually CHWs themselves. In a lot of organizations here, they are called promotores, they are called CHWs, and they're trained as patient navigators, and they become the patient navigator. But in the other organizations, they also have the patient navigators. They do not identify their workers as CHWs. So I think that as HASL, we do identify them as CHWs, and they are part of our workforce. But for organizations, it becomes asking them, how many CHWs do you have working for you right now? They do not count their patient navigators as CHWs. So that's become a problem to have the identification of CHWs in the work of practice and where they're working at. I think that it's been limiting our efforts in trying to get a count of how many CHWs we have in Arizona because of the lack of understanding of the scope of the model from supervisors and managers and also from clinical persons. So I think that patient navigators are really an extension of the practice of CHWs. They are CHWs themselves, but it's another role that they're taking. So it's actually, for us, it's just a name that it's put out there, just like we have now coordination care teams, and we know that there are also CHWs as well. So I think more and more we're going to have more names come up, and we know that each strand that comes out and it specifies what role they're asking, the organization that gets the role changes the title of the CHW, but we know that CHWs will always be CHWs, and for us, they all belong to our CHW organization.
Mm-hmm. Thank you so much. New Mexico, I'm not sure if I had started with you. If I did not, and you'd like to offer a response to that. BJ, Venice, I'm sorry.
Hello, can you hear me?
Yes, thank you.
Okay, I didn't know whether I was still on mute. New Mexico has been involved in policy development for a number of years, and the last legislation that we were able to get through the legislative process was to certify community health workers. And so right now, New Mexico is engaged in working on the all of the scope of practice, all of the different components for certification. There are large efforts taking place throughout the state with colleges and universities, community colleges and universities, to provide the certification training. So there's a lot of work that's taken place in New Mexico, and Denise has been involved with her program through the University of New Mexico Health Sciences to develop some of the competencies, the training for the different competencies that are required. And so she can talk a little bit about that as well. Denise, did you want to say anything regarding that?
No, we've been part of that process and have great lessons learned from developing those competencies.
Well, thank you. I'd like to thank you all for responding to the questions that we had. I know that you did not have additional time to prepare for those, so I really appreciate that. We are going to start to close out our webinar today, and I just really want to thank everybody who's participated. I particularly want to thank my colleagues from New Mexico and Illinois and Arizona. Your insights and thoughts were extremely valuable as we move forward. I would just like to say that it's really helpful to hear what's happening across the country. It's going to be crucial that we support each other as we move forward. I'm hopeful that you all will continue to join these calls. This was just the beginning. You know, we needed a place to start. And I would also like to encourage anyone who is able to join us for the Unity Conference as well. Folks know that will be happening in Tennessee in July. I think it would be a wonderful opportunity for us to continue the conversation that began today. And so my charge to all of you, and you folks who know me know that I can't leave without giving you all a charge. My charge is going to be to please connect with at least one other CHW. If you're a CHW, if you are a supporter or ally, connect with one CHW and share the information with them that you learned today, and share the value of us all coming together and learning from each other and promoting and strengthening our workforce. And with that, I'm going to give the last few moments to my colleague, Sergio.
Hi, Lisa Renee. Thank you so much. And thank you for the opportunity to provide these closing comments. I am thoroughly impressed with the conduct of this webinar, and I really want to thank all the participants who attended this webinar, and in particular the panelists who prepared so thoroughly. to provide the information they did. I learned a lot, and particularly impressed with the passion and sincerity, authenticity of the comments that were provided. I am certainly going to buy some T-shirts moving forward. So I do want to provide a disclaimer, and I want all the participants present to understand that our purpose in conducting these webinars, which we plan to conduct on a monthly basis, is to be informative. We are not endorsing any particular approach or any particular process, but that we do want to be able to support the development of regional and statewide networks towards the ultimate goal of establishing a national professional association of CHWs. I also want to draw your attention to a survey which we are conducting on the topic of future topics, because we do want that to be an informed process, and we want it to be informed by you participants so that it serves your purposes. The other thing that I want to advise is that we are, in fact, developing some social media interaction capacity, and so we will very shortly be building a Facebook page and perhaps other interaction processes. And then also I want to advise you, if you have not signed up for this webinar series, please do respond to Julie Avertine's emails so that you can get on the mailing list. Our next scheduled webinar is on June 16th, to which everyone who has signed up will get an invitation. And the topic of that webinar will be getting started, the fundamentals of building a CHW state network. And then lastly, well, there's two things I want to mention lastly in my 2 minutes remaining. But one is the importance, which I really heard repeated during this webinar, of collegial support and the importance of belonging to a professional association. This is a theme which has reverberated repeatedly throughout our own organizing here in New York. But certainly, you know, every practice pretty much has a professional association, and there is a really there's a really important value in practitioners belonging to a professional association of their own, and that sort of undertone really resonated repeatedly for me during this webinar. And so I want to thank those of you who contributed to at least, you know, that aspect of it. I also want to reiterate the sincerity and the authenticity of the participants in this webinar. You know, as our practice becomes increasingly more popular, there are a lot of people joining us for their own opportunistic values, and so it is really refreshing for me to hear such sincerity from our participants. And then lastly, I do want to thank Sanofi. I want this gathering to recognize that, you know, Sanofi approached me about maybe a year ago about their interest in addressing in their interest in the community health workforce and addressing some of the relevant issues. But they approached me in a way that was really professionally responsible and ethical, and I was impressed with their approach, particularly Anita as the leader of that effort. And so when they approached me, I consulted with several of my trusted colleagues, Lisa, Renee, Carl, Gail, several people across the country. And just because of the way that they approached us and their professional responsibility and their real desire to be appropriately informed, we felt it appropriate to partner with them in the conduct of these webinars. And so I look forward to meeting again next month and moving this effort forward to build a national Association of Community Health Workers. Thank you.
Thank you, everyone. We look forward and hope to hear you in June.
This concludes today's conference call. You may now disconnect your lines. Presenters, please hold.